Welcome to the What I Wish I Knew After Pregnancy Loss podcast. I am your host, Sharna Southan. I am an angel mum, a rainbow mum, a pregnancy loss practitioner, and trauma-informed coach. I created the Institute of Healing Through Pregnancy Loss out of my own experience with loss in the hopes to provide understanding and healing, educating people on pregnancy loss, and creating more women or men in trained support roles. In this podcast, I hope to shed light on what I wish I knew in relation to pregnancy loss, opening up the conversation, breaking the stigma, and bringing real-life stories plus guest experts. Thank you for being here with me today, and let's dive into today's episode. Welcome, beautiful souls, to the What I Wish I Knew After Pregnancy Loss podcast. Today, I have with me the lovely Lisa McCarty. Lisa is a writer and a women's health advocate for infertility, mental health, and maternal health. Thank you for joining us, Lisa.
Thank you for having me.
You're so welcome.
So glad to be here. And I love all the work that you're doing and talking about such an important topic. I know it affects so many women. So I'm so grateful to be here. Thank you.
Yeah, you're so welcome. Yeah, like you said, it affects so many women. And, when I was going through it, I felt like I was the only woman going through it. And I think that's one of the hardest things, like you're going through this like soul shattering experience, one of the darkest times of your life, and you feel like you're the only person going through it. So yeah, no, I really do appreciate it. I appreciate you being here. And did you want to share a little bit about the path that has led you to where you are today?
Sure. So we started fertility treatment when I was in my late 20s, around age 29. And I initially went to my endocrinologist, referred to by my OB, because I wasn't having a menstrual cycle for a few years. And what one person, may view as a few years of no cycle is like pure joy, which actually at the time, I wasn't trying to conceive it, and it sort of felt like a, relief. And then it became problematic, of course, because I wasn't ovulating. So went to my OB, they referred me to an endocrinologist, and we sat down and did the full medical history of, essentially my menstrual cycle when it stopped and if I was having any other symptoms. And I really wasn't, just we weren't getting pregnant. And so we went through a series of the baseline tests that are required with all treatment, before you start fertility. And everything came back normal. And so we were like, oh, what a relief, but unfortunately it wasn't a quick answer. Like I thought they were just going to give me a pill to magically fix it, and then we would go have a baby. And I think it's kind of an interesting perception, because in this case, perception was not reality. I spent the first half of my life trying not to get pregnant. And then, into my early 30s, it became, a battle. So we tried a couple cycles of IUI. They were all negative. I was not able to get pregnant that way at all. No positive tests. And then my doctor said he wanted me to try IVF, because they determined that I had, at the beginning of our IVF cycle, we were on medication. And essentially he said, you're overstimulating. You have a lot of follicles. And so they determined at that point that I had PCOS, which is a great, I was a great candidate for IVF, because essentially you can just take one embryo and put it back. So in a nutshell, we did our first IVF cycle was actually our lucky one. And I ended up being pregnant the first time and ended up having my daughter, who is now 11, which is crazy. The fact that I have an 11-year-old is crazy. But I actually thought after that, it took us almost 3 years to have that success. So it certainly was not easy by any means, but I thought we had figured it out at that point. And so I actually wrote an essay about this recently in HuffPost. You may have seen it. And essentially, I shared this path, and basically because we had, the one, I thought, okay, well, we figured it out. I'm no longer infertile, but that wasn't the case at all, because when we went back to try again, I still had remaining embryos. And I went back to try again, and we ended up in a series of 4 recurrent miscarriages in a year. And so we actually had a few negative tests before that. So we were continuing IVF, essentially. We did another egg retrieval and got more embryos. and then had 4 losses in a row. And so the first loss it kind of shook me because I didn't expect it. I thought we were just either going to get pregnant and have another baby, or it would be negative. I didn't sort of think about that state of purgatory that you go into when you have a loss, where you're like, something is wrong here. Like our bodies are telling us something is wrong. The test is positive, and then it's, they call 2 days, 3 days, or a week later and say the second beta is, declining. It's not going where we want. I'm so sorry. It's always like the same conversation that you just hear over and over in your head. But that first one, it was unexpected. I didn't think that we could have a loss, and I didn't know what that would feel like, of course, because it hadn't happened before. And I didn't tell anyone except my husband, of course, who was by my side through the entire thing. And so I thought I was supposed to just keep it to myself. I thought I was supposed to just sort of deal with it. And I definitely had anxiety during the process from, let's say, the time that we did our first IVF egg retrieval to, transfer, in between transfers, of course, for 2-week wait and all of that. But the anxiety that you feel and that new sort of level of fear that comes to you after having a loss, it sort of stays with you, right? I mean, it doesn't go away. And so then we started a new cycle again, the second time, and I had a few more embryos remaining. So we did another one, and then it was positive. We get the call from the nurse, and it's all very exciting and happy again. And I was like, okay, we got our one loss out of the way. We're going to hope this just turns out better. And then it was, I want to say I was like 7 weeks for that one. But before we even got the call from the nurse, I started bleeding. So I was like walking up the stairs of my townhouse, and, I'm like feeling like this heaviness in my lower abdomen set in, like something felt wrong. And then by the time I got to the bathroom, I had like, so much blood, and it was like obvious what was happening, but I still was hoping it was wrong, of course. And so I called my husband, and he came home. Luckily, he was in town when that happened, and we talked, and I said, you need to come home. Like, I don't know what's going on. Something seems wrong. Can you please come home? And so we called the doctor together, and of course they were like, well, come in. And so we went in, the endocrinologist did a ultrasound, and they said, I'm so sorry, So that was our second one. And then the third cycle, I was hopeful. I've talked to my doctors about it. Like, what are we doing wrong? Is there, do we need to try a new medication? I think we did ERA as well, like where you can predict the timing of the transfer and medication. And like, we switched the trigger shots. I mean, we did everything. The guy threw the kitchen sink at me at this point. And the third one I felt like was, it was another positive test, another positive call, and then the numbers were declining earlier. I want to say it was maybe around 5 weeks. So that one, I actually didn't have as many side effects, but it felt harder because it was like, oh my God, how much can I take? Like how much can one human being, one woman take of this loss? And then the final one, I was talking to my doctor, and I'm like, we've done everything we possibly can. This was basically our last embryo at this point. So we had gone through, this was my 14th IVF transfer, essentially. And I thought, no pressure, right? This is our last embryo, no pressure. This has got to work, So after the third miscarriage, essentially, we did the last transfer. But prior to that, what we determined was that there was something else going on, essentially recurrent loss. We can't figure it out. And so, my doctor basically said, you need to, we'd had these multiple recurrent losses in a year. And he said, you need to go to see a specialist. And I thought to myself, a specialist? Wait a minute, aren't you a specialist? What other specialists are there besides an endocrinologist? And so he referred me to a gynecological surgeon who specialized in pelvic, inflammatory disease, reproductive issues, anything from women who have gone through cervical cancer to women with endometriosis. And I didn't know at the time, but I had a condition that apparently needed addressing. And I didn't know that until I saw him. So it took me some time to get in for an appointment. And essentially, he did like a full physical, examination in a history as well, medical history. So basically, we went through all of the losses and everything I had been through to date. I also had multiple DNCs. One was right after my daughter was born and one after one of my losses. And so he said, well, based on the fact that you have had multiple losses and you've had multiple DNCs, I think you may be at risk for something called Asherman syndrome. And I didn't even know what that was at the time. And I remember thinking, let me just Google this, why is no one talking to me about this? My OB certainly didn't tell me, prior to starting treatment that I could be at risk after my DNC. And then also with the losses, my endocrinologist didn't say anything to me about it either. Like we hadn't discussed it in any capacity. So they had to do an evaluation hysteroscopy to determine what was going on. And he said, if I see scar tissue in the uterus when I do this, then I'm going to take it out. And then we'll have confirmation, most likely that you have Asherman syndrome. That's not to say that all scar tissue is Asherman's, but because of all of the factors that kind of combined together, that's what it seemed like it was adding up to. So he did the procedure, which was outpatient, in office. Like I was awake. It was actually in a hospital setting, but they have like an outpatient room essentially. And they tell you to take, a mild pain reliever before you go. The total appointment was 45 minutes for the procedure. And they take I don't know how specific you want me to get, but a very long tool that had almost like forceps, but they're like tiny version of them with a camera on the end that essentially goes up into the uterus and you can watch this entire thing real time. As if women don't have to endure enough in, in life with periods and other things. Now we have to deal with miscarriages and surgery while you're awake. I can laugh about it now because, I survived it and I'm okay. But it's definitely mind-blowing what our body can handle and what our mind can endure. So we did the procedure. He removed a large amount of tissue that essentially had gathered at what he called the fundus, which is the top of the uterus. And essentially what it did was it created like a clean space for us to potentially look at doing more transfers. But he said to me after he was done, I'm going to have to do this again a few more times because most likely what happens, and this happens for DNC or women with cervical cancer, if they've had, masses or things released, it's considered a trauma to the uterus. And so what happens is the body can react and creates more scar tissue. And so I essentially, after that procedure, had to take estrogen vaginally for 2 weeks. And basically what that did was it helped to heal the endometrial lining. And so we ended up doing this a total of 4 times.
Wow.
So it took a few months before obviously I knew if it was going to work or not. Because of course, when you're in that situation, whether it be after a loss and you're starting a transfer or, in my case, doing these procedures as well, I just wanted to know the answer. Mm-hmm. I just wanted to know if he was going to be able to fix it and if I was going to be able to have a baby again. And so, once again, it's such an impact on the mental health. I feel like it's just constant state of stress and like fight or flight, what's going to happen. But I learned some effective coping tools through therapy. And so I was able to, in addition to my husband's support, of course, I was able to get through that. So at the end of the day, basically, we did the last procedure and he said, I think we got it all. You can go try to have another baby. And so, of course, I was grateful that, months of this procedure over and over, they were able to resolve the issue. And then we did our final transfer and I did get pregnant and was able to stay pregnant that time and was able to have my second child. So, it's not always a fairy tale ending, of course. This is by no means a fairy tale because it took almost 10 years for me to have 2 kids, which is ridiculous. But, from the standpoint of trying to, support those that are going through it at this moment, I think it's so important to keep a perspective of staying present. That's like one of the things that got me through all of those moments where I thought, this has to be the end of this, right? Like we've figured this out and then something else would happen. We all just sort of wait for the shoe to drop at this point, you know? Yeah. So, there were a few things that helped me along the way. If that would be helpful, I can share those with you. So, a few of them were, as I said, staying present, really trying to, come back to where I was in that moment, whether it be, sitting in my car and just looking at my phone and talking to a friend and just trying to focus on that conversation and not everything else and taking it all on at once, because it feels completely overwhelming when you're in it. And then something else that helped was connecting with other women, because at the beginning of going through all of this, I didn't have that support at all. I didn't even know it existed, honestly. I was pleasantly surprised when I found, organizations like Resolve and the social media outlet, which it was never even, in my mind at the beginning, because wasn't talking to anyone, much less posting it, on a platform. And Instagram didn't exist when this started. So, connection with others. And then also, I think finding ways to distract yourself, of course, because we all need that, whether it be in the 2-week wait or you are just struggling through a loss and a negative test again, because I found, even just writing down plans, like in my calendar, making plans with friends or family or whatever. And then the opposite is true. Also not overcommitting yourself, because sometimes all we want to do is to just be by ourselves and not talk to anyone or explain to anyone how we're feeling, because it's exhausting. Which is why the connection with people who have gone through it is helpful, because then you don't have to explain, Anyway, I could go on, but I think those are the major things that really helped me. Meditation, I would say, is the other thing, because I feel like when I started fertility treatment and before our first loss, I didn't even know what meditation was really. Like, I thought it was something that people do when you do yoga, Mindfulness was not in my vocabulary at this point, in the early stages of treatment. And then it sort of became through therapy and going to yoga and connecting with other people and learning what worked for them. I learned that I actually could disconnect from my thoughts, even if it was just, for a few minutes. There is a way to turn off that constant noise outside of your, space. And I do it every morning and every night now, and still, because it is a way of sort of reconnecting back to myself and like, how am I feeling in this moment? And whatever it is, it's fine. Like, I'm angry, I'm frustrated, I'm exhausted. And then going, further into meditation, once you sort of continue practice, it does actually work. It's not a bunch of woo-woo, I know Jay Shetty and, lots of people on social media talk about mindfulness and meditation, but it actually does work, because it allows you to remember what it's like to have peace for even just a few minutes. So that would be my biggest suggestion is, and if you can't do it on your own, do a guided meditation. Those are like, I still do that even on walks. Like, I'll listen sometimes to a guided meditation if I can't shut the thoughts off, because we all have that. As women, we have our 27 things on the list we have to get done. Or, oh my gosh, we have this plan and that plan next week. But really, the best thing you can do for yourself is to give your mind a break, even if it's just for a few minutes, or listen to your podcast because it'll help get you through the week. Anyway, so I'm grateful to have come to this point, which is why it's so important to me to be able to share my story, because in both my writing and, through this platform and other ways, because I feel like I wish I had this when I was going through everything, because I didn't know that other women had losses. I thought it was literally the only person. And then a friend revealed to me that she had a loss. And then all of a sudden it was like, there was like millions of women. Like, how is this not being talked about every day? You know, like if I could get on your podcast every day, or if I could get on social media every day and just say, I had a miscarriage and so did she, and so did she. You know, there's so many people, because when we're in that moment, it often feels so lonely and so isolating and so debilitating. But I'm so grateful that I've found these connections, because I'm still connected to these women, you know, and it's like a lifetime, lifetime connection.
Like they just
Yeah.
get you. It's just that.
Yeah, they really do. And it's such a good feeling, isn't it? It like fills you up in your heart to know that like your words can help someone else, or vice versa, you know, for them to say, I hear you, I see you, like I understand exactly how you feel, and you don't have to say anything else. So, yeah. So that was me rambling, but
No, that's fine. One in 4 pregnancies will result in miscarriage. 1 in 8 women will experience infertility. 1 in 100 women will experience recurrent miscarriage. And 1 in 160 births end in stillbirth. Have you been wanting to make a difference in the lives of women or men who have experienced pregnancy loss because you can see so many suffering in silence, but you just don't know how? Collectively, we can change how bereaved parents can access mental, physical, and emotional support after their experience. There is a lot of women with unhealed trauma, and there is a huge gap in the current support system when it comes to bereaved parents' recovery after loss. There are too many women and men suffering in silence. The Pregnancy Loss Practitioner Certification is a worldwide, one-of-a-kind program that gives you proven methods designed for healthcare professionals, medical staff, midwives, nurses, doulas, birth workers, coaches, and angel parents alike. The Pregnancy Loss Practitioner Certification is bridging that gap. It will give you a proven support structure to follow and education specific to pregnancy loss, created by a loss mum. It is creating more education specifically for loss so that you can enhance your service and become the point of difference. Or you can create the support that you so desperately needed in your healing after loss. This is the next level of growth and expansion you have been searching for. So does this sound like something that you have been searching for? Let's explore this more together. You can head to the episode show notes where you'll find the program application, or direct message me on Instagram and let's open up the conversation in how you can use this education. You have a gift, and I look forward to supporting you and witnessing you bring your gift to the world, healing and transforming women's lives. There was so much of your story that I resonated with as well, but just the way that, you know, you were able to navigate it, you know, I really thank you for sharing your story so openly. I was going to ask, you know, which you've kind of shared the tools then as well in terms of how you navigated it, because going through multiple losses, like it is such a physical and mental and emotional toll. And even after one loss, I was like, how can I go through this? How can I put myself into that position again and fall pregnant again?
Yeah.
But my desire to have a child was so much stronger than anything that I was navigating. So I knew that I had to process what I was going through because I wanted a baby so much. Yeah. But it's such an important thing to realize is that you do need to give yourself that space to process what's actually happening for you in the moment and not dismiss it, not push it aside, not go, oh no, that's not, like, I can't feel that.
Yeah.
Because the moment we decide to push all of that aside, we push it back inside and it doesn't go away. It just stays there and it bottles up and it will explode at some point.
Yeah. And I think also it becomes a physiological response too. And that's what happened to me because I wasn't, honestly, I feel like I wasn't really dealing with the first two. Like I was dealing, but I was just like dealing with it in the moment. I wasn't really coping. There's like a difference between, I feel like, managing your symptoms and trying to get through the day and like actually dealing with it, and it became like I was so depressed and so isolated. And then thankfully, I found people that were going through it. And I was like, oh my gosh, I can talk about this. I don't have to hide it anymore. Because I felt like I was embarrassed. Like, oh my God, I can't even have another child. There's something wrong with me. And then, you go to events and people, when are you guys having your second? And it's like, that is absolutely the worst question you can ask any woman. Just don't ask the question. Just how's it going? And I know they mean well and, and it's a kind intention. But for those of us that have struggled, it's probably like the most dreaded question, because then you feel like you have to explain or you have to backpedal and get out of the situation. So did that ever happen to you? Were you ever sort of caught in the corner with a question like that? It's so stressful.
Yeah. Well, there was obviously a lot when we were trying to conceive. And like you, I was 30 when I decided that I was ready. Like you said, you spend like the first part of your life going, no, I don't want to have kids. And then I thought I was being punished for that choice. I thought I was being punished for me saying, I want to enjoy my 20s. But then.
Which you weren't, of course.
Oh, no, but it's just those.
Because it's almost like, well, why is this happening? Did I do something wrong?
Yeah. I'm like, I'm a nice person. Like, why am I getting punished? And I thought it was because of the choices that I had made or the statements that I had made. Like, there has to be a reason. But then we were trying to conceive for 5 years. So I was in my mid-30s when I ended up having my rainbow. So my first pregnancy ended in loss. So there was definitely a lot of questions, obviously, in those first 5 years going, when are you going to have kids? When are you going to have kids? And after the loss, when are you going to have kids? And so that was a really hard one to.
Yeah.
But I ended up I was like, well, I'm going to just tell you what happened, because I was sick of downplaying my experience. Like I was like, no, like I can't keep pushing aside the fact that I have gone through something. And then
pretending you're fine when you're not. I mean, that's what so many of us do. We think that we're a burden or we don't want to inconvenience someone else with our problems. But in actuality, it is better to say, if you're comfortable, of course, say it to someone that you trust and that you feel safe with, because it does help to talk about it. And I didn't know that at the beginning.
Yeah, I definitely didn't know it at the beginning.
You just think, I'll be fine, Let's suck it up and keep moving on,
But like you said too, like when I started opening up about it, I had other people opening up about their losses, which also helped in being able to sort of validate myself and what I was thinking and what I was feeling. So now that I've had my rainbow, I get a lot of people asking me now, when are you going to give her a sibling? And I'm just like, again, I'm back at the same story. Yeah. I'm not having any more children. We've decided not to have any more because, well, one.
You don't have to explain. There doesn't have to be a because.
Just for me.
Because I don't want to go through that again.
I'm 40 and I'm like, I just got the energy for one right now.
Yeah. And that's okay.
Yeah. And, I've got to the point now in my story that I'm just like, you know what, this is how it is. And I'm just confident in being able to share where I'm at. But yeah, like you said at the beginning, like I felt like I was the only person and no one would understand what I was going through. I couldn't talk to anyone because I would feel like they thought I was crazy or, that I was making it up, like making my feelings or emotions or thoughts up, like.
Yeah. Or making a big deal and being dramatic or whatever.
Because, I see a lot of women, saying because it was an early loss, they can't grieve because they didn't have anything physical on the outside to show. And I was like, well, you're grieving. Your body has gone through like a pregnancy and there's hormones.
A loss is a loss. Absolutely. I think I told myself that at the beginning as well, because it was so early. I kept thinking maybe this doesn't count as a miscarriage. I was so early and, I knew so many women that lost later after, like by my third time when I was actually talking to people about it. And I thought to myself, like, well, I don't deserve to feel like I can grieve because I was early on. So, oh, you were early on. It's good. It's fine. Sort of like dismissed a
Yeah.
little bit.
Yeah. It's just society's way of sort of saying, oh, like, it's okay. And like I was talking the other day with my grandma, actually, because she had 5 losses in between her 7 children. And, she was just told she had to literally, it was, get back up, dust yourself off, get back on with it. And she ended up developing her own coping mechanisms where she had to get on with it really quickly, but she was able to process her emotions, like what she was going through at the time of when she was going through them. But she couldn't talk to anyone. She couldn't, there was no support. And she was actually mentioning all of the things that society was telling her back then. It was like all the same things that they're all saying still, at least it was early, at least,
at least you can get pregnant.
Yeah. Or, you shouldn't be grieving, or you should be over it by now. Or there was so many of what she was saying. I was like, gosh, this is all still happening.
Yeah.
And that's the thing, obviously because I had my loss at 7 weeks as well, I didn't have anything external to show that I was pregnant. So I'm like, a lot of women are like, should I actually be grieving?
Yeah.
I'm like, well, yes, because your body has actually gone through a pregnancy and, it's valid, and that grief is there. And where there is love, there is grief. And as soon as you see that positive pregnancy test, or as soon as you get the phone call to say that it's a positive test, there's immediate, it's blind love. I think it's the true definition of blind love. You fall in love with that little person before you even know anything about them.
Yeah.
And then of course there's going to be grief. Of course you're allowed to grieve. But because society doesn't see it as anything huge, oh, it's fine. That's all right.
Yeah.
You can't grieve, or you can't be upset, or you can't, ask for time off for mental health reasons, or you can't, do all of the things because you're like, no, it was only an early loss.
Yeah. I think there was recently something in the news that said there are new rules around taking time off after a loss, that they're going to be, essentially changing that. But it's 2023, why is this just happening now? Yeah. I mean, I think that's why it's so important to talk about it, because the more that we talk about it, more women in general talk about it and acknowledge that it did happen, then the sort of decrease the stigma around talking about it, and also, reduce women feeling isolated and alone, and they have to struggle in silence, which they don't.
No.
But, so often I think as women, we feel like we don't want to burden other people with our problems. So we just do it, but we don't have to.
No, we don't have to. No. And hopefully when, in having these conversations, it's going to allow women to to see that they can talk about, their experience more openly, and hopefully in the coming years and generations, it will change that, it is viewed and spoken about. And, it is a big thing that women go through, and a lot of women are going through.
Yeah.
So you mentioned, obviously, when you were talking about your story, you've written an essay in the HuffPost, which I think is an incredible achievement in getting the message out there, getting the awareness out there. Did you want to share a little bit about kind of how that sort of came about and what you ended up popping in the essay?
Sure. Yeah. So essentially it was the story that I shared with my recurrent losses and being diagnosed with Asherman syndrome. And so the takeaways from the essay were specifically about Asherman syndrome and recurrent loss. So some of the questions that I had suggested in there were essentially, if you are having recurrent losses, talk to your doctor to see if you should be evaluated for Asherman syndrome. This is something that's not talked about enough with OBs and endocrinologists and doctors in general. I think a lot of women still don't know about it. And then the second part was, if you're under the age of 35 and you've been struggling for 12 months with losses, it may be worthwhile to talk to your doctor about being evaluated for it. And then if you are over 35 and it's been 6 months with recurrent loss, you may want to talk to your doctor. So that over 35, being, a larger impact because there's, you almost become, well, they call it a geriatric pregnancy, which is ridiculous. As you get older, certainly there are other factors too, but I feel like Asherman syndrome should be one of those things that should just be on a checklist, just like they do baseline testing, for various things when you go to a physical or when or you are evaluated for infertility or whatever. It's kind of the same thing. There's no magical test for Asherman's though. It's essentially doing this evaluation hysteroscopy to determine if you have scar tissue in the uterus and if it's impacting implantation. One of the things I did learn though along the way, and this was based on one study, I think it was based in Europe, and essentially it said that the factor of, if you've had a DNC, whether it be after a loss or after a child or for any other reason, if you have a history of cervical cancer, therefore another trauma to the uterus, if you've had recurrent losses or any miscarriage at all, where in the case where there would be like an incomplete miscarriage, those are all factors that could result in this scar tissue buildup, which can impact pregnancy and also, ironically, cause more miscarriage. So, and I didn't know that until it happened to me. So really, I think the biggest takeaway from my piece and overall, for me is that you have to be your own best advocate always and inform yourself, on what the possible situation is. So know your risks for whether it be for Asherman syndrome or any other potential situation related to pregnancy loss. I think in many cases, the doctor will say, endocrinologist or OB will say, it's early, it's a chromosomal abnormality that's most likely what caused it, which is generally true. But then there's, a percentage of the population like me that had this condition and I didn't know. So I wasn't sort of everyone else. And I think there is some data online that says that HSG procedures, where they kind of inject the dye into the fallopian tubes to make sure everything's clear, can potentially identify Asherman's because it lights everything up basically inside the uterus. But I actually had a few of those done and they never found anything. So I think it's only like 1% to 2% of the time that an HSG can find Asherman's. So really the only way to know is those factors that I mentioned. If you're having the recurrent losses, depending on your age, depending how long you've been trying. And then also, if you've had any of these procedures that are impacting, potentially could impact implantation. So, so I feel like I'm always the rare case for everything, in all of my trials and tribulations of trying to have babies. And, while I'm grateful, of course, that it turned out the way it did, I certainly think that it's almost like my duty to pay it forward to other women because I don't want them to have to go through what I did, because it's no human being should have to go through any loss, not to mention, multiple losses. So if whoever is listening, if you are struggling with recurrent loss right now or any miscarriage at all, just know that you're not alone and that there is help, and talk to your doctor to see if you should be evaluated for this condition, because I feel like I wish I had asked that question, long before we ended up at the end of that year, basically. So,
yeah. And it's just how, I think we go into it so blindly and you just assume that the doctors are going to know. And, and
sometimes they don't.
No.
Until you're in that space of like all the stars line up and they say, oh, well, you have all these symptoms. So maybe there is something else going on. Yeah, you're right. And I think we like to think that our doctors can answer every question because they're a medical expert. But in some cases, we know our body better than anybody,
Yeah. Yeah. And, it's sad that, in the eyes of the medical field, you have to go through 3 losses before they actually go further and test you for other things. Yeah. So, even after 1 loss there, sometimes, like you said, it can be an abnormality, which a chromosomal thing. And for most cases, that's what early losses are. But, what if there was something else? Like even after 1 loss, like it takes such an emotional and mental toll.
Yeah.
Like, can we advocate for ourselves and can we ask these questions earlier so that we're not having to go through, more agony, more heartache and years of, not knowing, like, or multiple tests and different specialists and, so I really,
I mean, at the end of that, the fourth loss for us, it felt like I was about to give up, I mean, you don't really know what to do in that situation. And we had one shot. I think I misspoke earlier when I said it was the third. So it was 4 losses in a row. And then we did our final transfer after that. But there was a gap of time after the fourth loss when we did the evaluation. So, we have to keep track of our timelines. It's so hard. And it all becomes a blur, I feel like, because we almost block it out to some extent, Thankfully for my writing, I'm able to kind of relive it a little bit and kind of go through those, use my coping tools that I can, but it's not easy. Yeah. I mean, I think just at the end of the day, it's listening to your body and knowing if there isn't something that's working, talk to your doctor and don't feel like you have to, search Dr. Google or Chat GPT for an answer, because that is not, I highly recommend not doing that, because I feel like in a lot of cases for me, it came up with bad results. It told me that I was probably never going to have a baby. So you just really, you don't know what you're going to come up with on the internet. The internet is definitely not your friend when it comes to this. And I've heard actually recently from fertility doctors that are hearing more from patients saying, I saw this on Chat GPT, like almost like arguing with them about what the doctor is telling them. While I said, we know our body best, I definitely would say that Dr. Google and Chat GPT does not, and that we should definitely, build a close partnership with your doctor and make sure you feel supported and that you're getting somewhere. And if you're not, then go see somebody else, someone that can help you. There's nothing wrong with that.
No. And it's about building the team around you that's going to support you moving forward. And, if something doesn't feel right or you're not getting seen properly by your GP, like you're asking the questions and they're kind of dismissing you a bit, but you're like, no, this is like that inner niggle that you're just like, there's something that I need that's different. And if you're not getting it from that doctor or that specialist, absolutely do your research and go and see if you can find someone else. And definitely don't go into Google and Chat GPT, because yes, they're great for other things, but not for stuff like that. Like I did the same. I mean, Chat GPT wasn't available to me back when I was going.
Yeah, I was going to say it probably doesn't exist.
Google did.
Same here. Yeah. It's the same idea, obviously. I think it's a great tool, but like you said, for other things except, calculating your likeliness of whether this miscarriage is going to be the last one, because ultimately your doctor and you are the ones who are going to know that answer.
Yeah.
And sometimes trial and error is the only way to know, really.
Yeah. And it might not be an easy road, but just having the tools, like you said, as well, to support yourself going through it. I think absolutely being able to have that mindfulness and tapping into your body and what your body needs from you in that moment and listening to that, like that's really powerful. That's going to help you through the tough times. And, is there anything else that you feel like people should know, if they are going through navigating infertility and pregnancy loss that you haven't already mentioned?
I think just really consider using tools that maybe you're even resistant to, because I think early on in the process, I didn't think about writing as a tool, but it has become one of the most powerful tools for me, because sometimes when I'm writing, I don't obviously publish everything that I write. A lot of times it's almost like a journal, and I write daily in the morning for a few minutes and then before I go to bed. And I feel like it sounds very simple and sort of almost like a duty, something that you have to do, but it has actually helped in my process. It really helped me to identify how I was feeling without even knowing kind of where I was. So, through my writing, I identified, wow, I am still grieving about this, or I am still struggling with this, because it's just kind of whatever comes up in that moment is what I write about. And the writing before bed actually has been one of the best things for me because it helps me to clear my head before I go to sleep. And then I kind of feel like I can sleep more restfully and I get up in the morning and I feel like I'm starting again.
Mm.
Because otherwise, without those tools and, as you said, mindfulness techniques and support, I do feel like it can be overwhelming. So just try to take it one day at a time and try to implement little things that make you feel good.
Mm. And definitely not trying to implement too much all at once, because then that's just going to become too overwhelming and you probably won't do any of them.
So do what's manageable, maybe choosing one thing this week to try, like go for a walk for 10 minutes each day. That is manageable. And there is a lot of data that says you can calm your fight or flight feeling in just 10 minutes. It calms the amygdala response and brings back online your thinking brain, which is essentially kind of your rational side. Like if the world isn't crashing down, tomorrow is a new day. This is temporary. This moment is temporary. What I'm going through right now, it will pass. At some point, it will pass and I will get through it. Somehow I'll figure it out. And just taking 10 minutes to get outside, get fresh air, choosing one tool. I think you're right. Don't overwhelm yourself with options and just choose something.
I think the writing was definitely one thing that helped me through as well. I was essentially journaling every morning and every night. And like you said, the nighttime one really was profound for me because I was able to just get out what was in my head. So then I wasn't going to bed with such a noisy mind, and it all had a place. Then I wasn't thinking about all of the things and going, and trying to analyze it. It was out and it was on paper and it had a place.
Right.
And I was like, well, it's out. It's there. If I want to address it or do anything with it, it's on paper. Like I don't have to remember it anymore. I don't have to think about it anymore.
Yeah. And you don't even have to go back to it again if you don't want to. I mean, it's really just a place to put those feelings and thoughts when you can't cope with all of them at once.
Yeah. Yeah. So definitely, thank you for sharing all of the tools that worked for you. They're all very powerful and I think really, really valuable in the moment tools because that's what we need. Yeah. In those really tough moments when you're feeling overwhelmed, triggered, feeling like, literally the sky is going to fall in, to be able to think more clearly, feel into your body better and support your emotional, physical, mental health as well.
Yeah, definitely. I agree.
So do you want to share where people can find you, or even also I'll link everything in as well because I want to pop your HuffPost essay in there as well. But do you want to share where people can find you and read more what you do?
Yeah. So on Instagram, you can follow me at LB McCarty717. 717 is my wedding date. So that is, and actually the date that I met my husband. So that is the significance of the number, in case anybody's wondering, because it is random. And I'm also on Twitter as well, and I can send you the handle too. So
yeah, absolutely.
Definitely give a follow. And I try to offer a safe and supportive space on my page with daily inspiration and quotes from other inspiring women. And I try to share women's health related content that is valuable and, can offer you something to take with you.
I think everything that you've been sharing is so important, especially like everything that you've experienced and, being able to advocate, supporting women to advocate for themselves. And especially even diving into Asherman's, like it's not something that I was aware of too. So I thank you for being able to share about that and bring awareness to that and educate women on that as well.
Thank you. Yeah, I feel like it's my privilege to be able to do that because I feel lucky to be able to share this. It also feels very healing too. As much as, I think so much of it is service to others and helping others. But then the other part of it, I think, is healing all the things that I went through. And like you said, through writing, it's such a cathartic outlet. So it just feels like what I was meant to do. So I'm grateful.
Yeah, thank you so much. And healing's an ever evolving journey, isn't it?
It really is. Well, and it brought us together. So I'm grateful for that too.
Yeah.
Thank you so much for having me.
Oh, you're so welcome. I'm so grateful that you were able to come on and share everything. so open and vulnerably. So, I truly appreciate you and what you're doing in your time.
Thank you.
Thank you to all that have listened in. If this episode was valuable to you, I invite you to leave a review on Apple Podcasts, and I look forward to supporting you on the next episode. Thank you for listening in with me today. I hope you found this episode helpful. If you did, I would absolutely love to hear from you. Take a screenshot of this episode, share it to social media, and tag me at instituteofhealing_PL. I love seeing what is resonating with you right now. If you want to chat further, I invite you to connect with me through Instagram. Head over and follow my Instagram account, send me a DM, and let's open the communication. If you want to know more about how you can be the support for others, head to the show notes and fill out the application form for the Pregnancy Loss Practitioner certification. I want to also note here that what I share within the episodes is not medical advice. If you need further support, please consult your doctor. Thank you again. Much love to you. Be gentle with yourself, and I look forward to supporting you on the next episode.